or do you think there's?
Yeah, I didn't want to do that yet. Morning. There we go. Hello, everybody. It's 11:01 or 11:02 here in the Panhandle. We want to welcome everybody to our Zoom call for today. My name is Jim Howard. I'm the Area 1 Chair for Family Care Council, and I'm also the Community Resource Director for By My Side. For today's call, we've got Lisa with the Family Network and Disabilities STAR program. That's going to come on and let us know about the statewide resources to help families in that direction. So we'll get some more from her. We are recording this, and we'll be sending out links to everyone who registered after processing. But I wanted to take just a second here um, and talk about By My Side. We're your partner in special needs assistance. We're consultants. We help families find resources throughout the state of Florida and also throughout the United States sometimes. We believe in the power of connecting with others, with other agencies, with other families the best we can. And we have lots of different resources on our website. So we have services and resources. We have homeschool connections, which for our families who might be doing homeschooling or considering that. We have special tabs for that. All of our workshops are free for caregivers, either if you're looking for family resources, such as like Family Network on Disabilities, or if you're a professional working in the field and you need to look at how can you better serve your clients out there, or how you better document it so we can keep those services going. The website currently supports Family Care Council, and we also have links to We the People, which is a grassroots movement in Florida with that. So with that, Miss Lisa, I'm going to try and flip it back to you. I think that's a new share. So I'm going to stop sharing, and I'm going to see if Miss Lisa can pick it up and go with.
Great. Thanks so much, Jim, for inviting me to be here. I see we have two participants joining us. I'd love to know if you could put in the chat box whether you are a professional here working with supporting families, or if you're a family that's supporting a loved one with a disability. So I'm curious to know who I'm talking with today. So if you could put that in the chat, that would be great. Get an idea of how to support you. And we will open it up after I share all the resources. So if you have any specific resource questions, I'll be happy to work with you on that.
Right now, we have Miss Annette Zeb, which is our wonderful resource lady out of Agency for Persons with Disabilities in our area. She sends out lots of different emails and resources from one end to the other. And Mr. Dwayne, I believe, Dwayne, are you on? I would hate to tell you the wrong title. Maybe not. I believe Mr. Dwayne also works with the bulk rehabs person through Agency for Persons with Disabilities. And that's what we have so far.
Okay, great. Hopefully we'll have a few more people jumping in a little bit. So I am going to start the presentation. And as I mentioned, I'm going to walk through some resources with you, so you'll have quite a bit of information when we finish today. I hope you are able to see the slide. Jim, are you able to see it?
Yes, you're good.
Okay, great. So welcome to this presentation. I'm going to familiarize you with Family Network on Disabilities. We're kind of the best kept secret in Florida. And we have quite a bit of history, and Jim knows that. We've been around a long time, and a lot of people are still not aware of the work that we do to support families and professionals in the field of disabilities. So I'm hopefully going to change all that today. So before I start and talk about FND, I want to tell you a little bit about who I am, what I do with the agency, and why I got into this field. So my name again is Lisa Math. I'm director of the Family STAR program for Family Network on Disabilities. And as I go through this presentation, you'll learn more about that STAR program that I'm talking about and how we can support your needs or support the families you're supporting. But I am also a certified recovery peer specialist with an endorsement in working with families. So that allows me to use my professional training and my certification and my continued ed, along with my lived experience as a parent of an individual with a disability. So that certification is very specific for individuals that have that lived experience, which is really important because the work that I'm doing when I'm working face to face with families is really not just about the resources, but it's really about making them feel heard, them feel understood, and really empowering them in the journey. So that happened. My certification came about because of my personal lived experience as a parent of a now 26-year-old with medical and mental health challenges. So that experience came on very early. I had multiple medical experiences with my child at a young age that just basically consumed my life. And I ended up giving up my full-time career, becoming a full-time caregiver. Many of us know all about that. And allowing me to learn intimate information and engagement strategies for systems of care. And all those years that I was working through all of the providers that my child was utilizing, and there were at any given time 6 to 8 different medical and mental health providers involved in our family's journey. All of that information really, it sat well with me, and I felt like I could move forward and pay that information forward in a professional manner. So I ended up using that knowledge and getting certified. So this has brought me to the world that we're in today. My young adult child, my young adult son, is successfully independent. So I'm very excited about that. But it was a hard fought journey all the way through, trying to make sure that we were getting the right resources, understanding the system, understanding our rights, which is really critical in this process, and knowing that we had support. So that's why FND is so important to everybody on this call or this webinar, and why we're here to support you in this journey. So let me tell you a little bit about the history of FND now. We are a 501c3 nonprofit operating throughout the entire state of Florida. So we work not only in the Panhandle, but all the way down to the Keys. I'm actually based in South Florida, so I'm not even close to where you all are right now. And we work because of the funding we receive, the grant funding that we get from the U.S. Department of Education and the U.S. Department of Health. So those dollars allow us to work with families, self-advocates, educators, professionals, and providers across the state at no charge. And we all know how expensive it can be to manage the expenses of a disability. So the fact that we have this available at no charge is really important for families to know. We started as a grassroots organization in 1985. I told you we've been around a long time, and we just have so many tentacles in this state trying to get the word out that we are still here after 39 years and counting. So we're very excited of the history that we bring to the work that we do. It started in 1985, as I said, by a group of families who have children with disabilities and were looking for support. They could not find it. So what happened, they created a small community-based grassroots organization, and the support need was so great that it continued to grow, and it went statewide. And as it expanded, our reach not only met all of the needs of the state communities, but we actually expanded into work on a national level. So we do quite a bit of national collaborations with the U.S. Department of Education, U.S. Department of Health. We're on national learning collaboratives. We really do have our mark made in many, many areas to support the disability journeys. And I mentioned about the lived experience. And so what makes FND unique is that we hire individuals who have lived experience, either with their own disability or with a loved one with a disability. So right off the bat, those staff people that are getting hired have an experience that they bring to the table that may very much mirror what you're experiencing, or can at least align with the challenges that the families and professionals are faced with. And so we're able to really connect quickly. I do always need to qualify that at FND, we are not attorneys, medical professionals, or mental health clinicians. So we do not offer medical or legal advice. But what we do, if we need to guide you in that direction, is get you to the appropriate nonprofit organizations that can support those needs, or that can direct you to those providers. We do provide the information, resource linkage, and training and education and support for all of those populations. So I'll begin with our mission statement. And this is what our guiding principle that really does direct the work that we do. Our mission statement at FND is to strive for the complete integration and equality of persons with disabilities in a society without barriers, and to serve families of children with disabilities, ages birth through 26, who have the full range of disabilities described in Section 6023 of the IDEA law. So I don't always make assumptions about people understanding what IDEA is, so I always like to throw in a little explanation there. IDEA is the Individuals with Disabilities Education Act. That is our federal law that guides how our special education dollars are administered throughout the school districts across the country. It guides the schools, the districts, and the national programs that support education programs across the states. So here's a graphic to help you understand the different divisions of Family Network on Disabilities. So I am here and I'm going to talk more about Family Star, but I want you to know the other work that we do in the state rather. So you see Poppin, PSN, and PEN. So those are what the 3 parent training information centers that are funded by the U.S. Department of Education. Poppin, which is parents offering parents information and networking, is in the north part of the state, as you can see by the graphic. That's the area that oversees your FCC Council. We have Parent Support Network, which is in the southwest and south central part of the state, and then Parent Education Network, which is in the southeast and south central part of the state of Florida. All 3 of those, as I mentioned, are guided by the state IDEA, the federal IDEA law, and the work that we do to support families that have any child with any special needs in the school districts is guided by the federal statute. So we are keeping families apprised as to what their rights are, how to engage on IEP and 504 team meetings, what to do to get the services they need and the evaluations they need, and so forth. And we work with those families through the age of 22 as they move out of the school environment. The Family Star program, which I'll talk about a little bit more in a bit, as I mentioned, is a statewide program. So we manage the entire state of Florida under this grant. This is the one through the U.S. Department of Health. And this one allows us to support families with children from birth to age 26 with any type of disability. So that's complex medical conditions, special healthcare needs, developmental disabilities, and mental health diagnoses. It's very broad spectrum of services that we provide. Again, it's that resource linkage, peer support model that we do with the PTIs as well. We have a special needs trust department separate from our programs department, and we have other programs as well that we work with marginalized and underserved communities, such as fathers raising children with disabilities, or the non-English speaking communities, or the African American communities. We have small groups that we work with, as well as populations on our Facebook pages.
So if we have parents that are looking for school resources that live in Panhandle or the top part of that, it's best to reach out to Poppin. And if we have
Correct.
families that they have more of the medical side, then it's best to find you and connect with you. So,
Correct.
and
Absolutely perfect.
another neat thing about your website is if you have a Spanish speaking family, or you can get information through Spanish. And what other languages do you cover on the website?
We have, and I'm actually going to show you, and I'm going to show you the
Okay.
translation service on there. We have Russian, Creole. No, I'm sorry. Russian, Spanish. I'm trying to remember if it's Creole or Portuguese. I'm forgetting now.
I believe it's Creole.
Yeah, I think it is Creole, but it's funny because I'm, like, for some reason, not remembering that. And I look at this website constantly.
Okay.
You look at it and you see it, but you don't see it. You know how that works. But I am going to go through the website with you and show you where all of the resources are, especially for the Family Star program, so that you'll actually be able to access them when you have time.
Wonderful.
So this graphic is more specific as to, you can see how the regions are split. Again, as Jim mentioned, because your FCC Council is in the Panhandle area, your needs, or the families that you may be serving that may have needs in the school districts up in those Panhandle areas, would be contacting Poppin, and all that information will be at the end of the slide. The other 2 are, as you can see, divided up, and they have their territories that they manage for those school districts. And then, of course, as I mentioned, Family Star is the one that manages the entire state. So I started to talk about the Parent Training Information Centers, and I want to clearly define what that is because some people don't know. This is actually written into the IDEA law. There is a section in there that talks about every state must have at least one Parent Training Information Center. In Florida, because of our size, we have three, and all three of those federal grants are housed under the F&D umbrella. So we're very fortunate, number one, in Florida to have all three together because the amount of collaboration and resources sharing that goes on is really incredible. We literally just call one of our staff people and we can share information and knowledge immediately as opposed to having to connect with another agency and get the right person. We all know the right people now because we all work together. So it's really exciting for the families and the professionals to know that Family Network on Disabilities has the oversight and the capacity to manage all of that.
And
It is
also, I'm sorry, I don't mean to,
no,
but
go
with a
right
parent, with a
ahead.
parent training and information center, there's tons of resources for the school staff in that direction also. Um, if your teacher or if your parent that's struggling with trying to find the right way to teach your child about noises or sounds, or maybe you're going to the dentist for the first time. There's also storyboards located with that.
You actually are jumping ahead of me. You got
Sorry.
everything scheduled. Listen, that's great. I love that you and I are in sync there because that's all going to be covered in this presentation. I'm going to show them exactly where to find all that. Um, so again, the PTIs are funded under the U.S. Department of Education, and that department that oversees that funding is called the Office of Special Education Programs, or OSEP. So under the umbrella of the U.S. Department of Education, there is this office that manages the special education programs across the nation, and that is where we are managed through. And so the Parent Training Information Centers have their technical assistance through OSEP's office. And as I mentioned, it is mandated that every state have it through the IDEA law. So that's important because we know there will always be parent training information centers available in all the states as long as that federal law is not rewritten in any way. Oh, and then as I mentioned, there's a minimum of one PTI in every state. So there's more than 50 of them, obviously, because we have more than we have three in our state and more in other states. So Family Star, parallel to the Parent Training Information Centers, is actually a family-to-family health information center. That is a program or grant that is managed under the U.S. Department of Health through the Office of Health Resources Services Administration. So just like with the Parent Training Information Center being managed by OSEP, our F2F, or the Family to Family Health Information Center grant, is managed through HRSA. Very similar in the technical assistance makeup of the two grants. And what we are doing is supporting families, as I mentioned, with children with disabilities through the age of 26. We are here to do all of that work with them. What's unique about this and different from OSEP, although the Parent Training Information Centers are mandated through the IDEA law, that is not the case here with the F2Fs. What's different in this case is that we are actually mandated through Congress. Congress appropriates the dollars that go to the family-to-family health information centers. And we have authorization, continuous authorization, and it is reviewed regularly. We are actually in the process right now of review, and we're, as a national organization of family-to-family health information centers, we are working collaboratively with our national office to get Congress people to support the reauthorization of the grant funding that comes from the government. So we're in a kind of a pivotal point right now to make sure, but hopefully this will continue to be funded and increased funding because we know the needs are greater and getting worse. But we are unique in that Congress has something to do with our existence. And sometimes that's a little scary when I say it out loud.
Mm.
So how do you get engaged with Family Network on Disabilities? There's a lot of avenues to get involved with us, whether you're a professional or a family member. Obviously, we have a very active presence on social media. We're 7 pages on Facebook, we're on TikTok, we're on YouTube, we are on Instagram, and we are very much evolving and keeping up with the times. We're using AI to generate all kinds of things that we're posting, such as workshops, and we're utilizing AI to do little snippets of information on TikTok. So we're really progressive in the way that we're working through with the families and the professionals. We obviously have email lists, blast lists that go to thousands and thousands of professionals and family members across the state. Those email lists send out information about, we have newsletters from Family Star, we have surveys that go out from both the projects. We have updates and information about law changes that we send out on that blast list. So that's important information to send out. And I'll share with you at the end more about how to get engaged with that. Of course, by calling into the organization and getting information or sending us your information, we can reach out to you. We have a presence out in all the communities that we serve. We are at disability resource fairs, we are community fairs, we're at events, we're at disability types of workshops and university programs. We really are very visible in the disability community, and we meet face to face. We're on interagency councils across the state. We're out in the community at different meetings for the special populations that we serve. We're out in the community when we are meeting with families one-on-one as well, or meeting with professionals to help support their needs. So we really are very accessible. We also do technical assistance and training. We do that in the community for families. We give educational programs for families. We do it in the community for community providers. And we are out there training professionals in the school districts as well as to how to engage with families and how to understand the rights of the family members, not just the rights of the school districts as well. We are also being tapped on a national level for various organizations to provide technical assistance for not only the F2F, but the PTIs. And now we're being tapped quite a bit to train for AI usage in our field.
That's
One,
certainly a new one that's coming about. It's kind of scary in
oh,
its own way.
let me tell you, Jim, this is a whole new world to us, and we are getting a lot of very in-depth training. F&D has hired a consultant to work with our staff to train us really well on AI and how to best utilize it to support the families, to support the professionals, how to maximize our dollars to get more exposure and reach. Like, for example, we obviously don't have staff members that speak every language, but we can get avatars through AI that can speak languages that we don't have access to. So we can record these videos and have them recreated in the AI platform with other languages. So we don't have to
Wow.
have the staffing, and we're
Mhm.
sending that out across the communities. So we are really making inroads in that. And we're becoming known for this nationally. Joe, our supervisor
Mhm.
and director of programs, is out there training across the country now on AI platforms to help support nonprofits. So it's really it's taken us to another level of really engaging in the community, which we're very excited about, obviously.
Wow, that's great.
Yeah, yeah, really exciting. So something that is important to understand with F&D that we're very proud of is that when we are putting anything out into the community, whether it's an infographic or one pager, a workshop or a training, anything we put out there, you can be sure we have done some homework on it. We've done some research to make sure it's best practices or evidence-based material, that it's something that can be verified and vetted, and it is in fact being utilized in the system. So we are staying on top of that, regularly updating. In fact, I just updated a workshop that I do on SSDI because they change information regularly. So I have to
Mhm.
regularly update that. We are getting information from the U.S. Department of Education, the Office of Special Education Resources, the Center for Parent Information and Resources, the Bureau of Exceptional Student Education, the U.S. Department of Health, Centers for Medicare and Medicaid Services, the Substance Abuse and Mental Health Services Administration, the National Institutes of Health, the Centers for Diseases Control. So as you can see, we really are going to the most recommended and most vetted resources to build out the information that we share.
Great.
So this is where I want to share a little bit more about our website. So I'm going to go over to here. Actually, I'm going to, yep. Okay. Let me expand this, make this a little bit bigger. Tell me if you're able to see that.
Well, I don't know if it's my screen, but it went off screen, so now it's really big.
Yes, I
I,
want it to be bigger. Are you able to see the whole page?
well, I can read on my computer hurricane season disaster readiness for
Right.
people with, and it
Okay.
stopped.
Okay. Do you see the top here where it
Yeah.
has the home? Okay. Perfect. So that's what I want you all to be able to see. This is our landing page, actually one of our landing pages at the home of FND. Okay. I'm going to come back to this,
Okay.
but I want you to see this is our home page. Okay. And as as Jim mentioned, and as I was mentioning, yes, we have 4 languages here that you can translate the entire website so that you don't have to struggle to read if English is not your primary language. So as you can see, we have Spanish, Russian, and Haitian Creole. So I want to show you what it looks like when you hit one of these to translate. For example, Russian. So as you can see, it's now translated to Russian. So it makes it so much more accessible for you if that is your primary language. If you speak Haitian Creole, same thing. And of course, Spanish, that you can read this and have it accessible in your primary language. So we're really proud of that. We think that that's important information to get out into the community, that this is an accessible website for those languages. So I'm going to go
Wonderful.
back. Yep, go back to English. And I want to show you, I'm going to take you across this area here where our resources are. So the information hub, when you scroll around that area, as you can see, there's drop downs, and I'm going to walk you through these in just a minute, but I want to familiarize you with the rest of the website. So programs, when we go to programs, all of those things that I told you about, the different programs are listed here, and then you can go into them and get more information. Okay, so this was one of those sub communities that we talked about, the advocates and the youth.
Advocates. Yay. Dads are out there doing it too. And there's a program for us if you're looking
Absolutely.
for it.
Absolutely. We don't want to forget you guys. We're very important to us. So this is our calendar, and this is really important. As you can see, look at that. We showed up there on our calendar. Yay.
Cool.
So if you go into the calendar, it will tell you all of the presentations we staff members are doing, but also we share events of different community events. So for example, I'm going to put this to the month, for example. And if you open each of these links, like if you go there, it'll give you the link to go into it, and you can open the flyer and get more information on this. So we are now doing a series, a 4-part series for families through Family Star called Parents as Leaders. It's a revamped, completely new 4-part series that's been updated and contemporized to what it's like to be a leader, a family leader in the field of the disability world. And so I encourage you to jump on these 4-part series. So as you can see, these are the topics that they're going to talking about on this first part. And if I go back in words, you can see that all 4-part series is running. So that's part 1. And then here's part 4. And I'm a little confused. I'm not sure where part 3 and 2 are on here, but they should be on the calendar somewhere. That's the one we're doing right now. So we're on the calendar, as you can see. Here's one, Lunch and Learn with Osceola School District. So again, I encourage you, if you have programs that would be appropriate to put on our calendar, send them my way. I'll get them on the calendar for you. We want families to not only know about FND, but all the other resources out there.
And
Okay.
I think it's important to mention that, maybe your parent who lives in Pensacola or, somewhere in Jacksonville, what have you. Um, a lot of the resources that you all cover are statewide resources, and there's a lot of information that you can connect to regardless of where you live, which is really, really kind of neat.
And not only that, Jim, because so much of the work we do is virtual now because of the length of the state, obviously I can't be everywhere. It's
Right.
accessible to anybody. It doesn't matter where you live. If I'm giving a presentation on understanding the systems of care, it's appropriate to anybody and it's accessible to everybody. So it's a great thing to remember that we have programs here that are available, not just to the Panhandle community. So that's important. And then, of course, if you do the drop down about us, it'll tell you about the staff and our community, how we started. So let me go back to the information hub. So information hub. This is the general hub, sort of kind of tells you all the different resources available and the different categories. As you can see, you can explore by topic. And then there's other things here, as you can see, that we can explore: web links, videos, trainings, and so forth. If you go back to the hub, we have our special education resources. So these are the resources you can see. They're also in Spanish. These are the resources that are through the Parent Training Information Center. And I'm just going to open, I'm not going to open the resources, but I want you to see the quantity of resources that are available. And this is every one of these, when you open them, can have anywhere from 3 or 4 to 10 or 15 materials under each of these categories. So there's quite a large amount of resources that have been added in. And
so you can also view them, but you can also download them if you have a need to.
Absolutely. Download them and print them. You can print them and bring them to your IEP meetings, your 504 meetings. You can bring them to provider meetings to help bring that conversation to the level you need it to be. The one here, these are one pagers. So if you open this, there are multiple educational one pagers. Every one of these can be downloaded and populated. And some of these are also Family Stars. So they're kind of a little mixed up in here. Like, for example, the coronavirus ones, those would fall under Family Star. But as you can see, we have military families. I know the Panhandle has a big military community. We have resources for communicating with your child and behavior challenges, understanding the importance of reading at home, taking care of the caregiver. Every one of these, as I mentioned, if you open it, you can print it. You can download it and print it. So that's really
wonderful. That's really expanded in the last few years since.
Oh my gosh, yes. I could have, and I've been here almost 5 years, so I can imagine in just the time that I've been here, I mean, the amount of resources that have been added, and certainly since your time with FND certainly has changed. So these are the Family Star resources, and these are not the only ones on the platform, but these are the hub, if you will. So we have information on CMS and applying for a job, disability emergency plans, mental health, healthcare planning, understanding strategies for bullying, IEP meetings. Again, we intermingle the IEP with Family Star because remember, many kids that have an IEP have parts of that IEP that are addressing social, emotional, and medical needs. So we are very much integrating all of the work that we do. Understanding populations such as the LGBTQ community, understanding the differences in home health care, obesity, health insurance. That's a big one. A lot of people do not know the difference between a copay and a co-insurance. So we need you to understand all that to be able to be an effective advocate for the child. So this is some of the Family Star ones. I think I mentioned that I want to share with you the disaster one. Let me go to that. So we have
hurricane season's coming.
Yes, we need to be prepared. And it's when you have an individual in your household with a disability, preparation is completely different for disaster. So it's important to be knowledgeable. We have booklets that you can actually download and print that are very informative. I want to get to those booklets, and sometimes I have here. Okay, no, I'm sorry, that was not what I wanted. Nope, I put the wrong thing in there. Let's see, disaster supply kit. Okay, this is not behaving today. Hold on. All right, let's go to disaster readiness. That might help it. Okay, I'm not finding what I need. Wow, okay. Let's try preparedness. I had it on my link before. That's why I took it off by accident.
I think it's also important to mention we're not only dealing with the threats of hurricanes in Florida, but sometimes that can include a chemical spill that can uh, you know
Yep,
cover a
yep.
lot of different areas.
I'm a little frustrated because I had it up on my queue before and I can't get it on now.
Uh-oh.
Yeah, disaster. Thought I saw it here. Now, those are videos, by the way. As you can see, these are all videos that if you go back in there,
Mhm.
let me just show you this, for example. No.
No,
Okay.
families don't have stress with kids with special needs. There is no
Really?
stress.
Really?
No,
No,
there's no stress.
no, no.
We're
So
fine, right?
if you actually go on Family Star Facebook page, all four of these videos are on there archived, and they are the 4-part series for disaster preparedness. The first one is protecting um, and preparing for a disaster, what that looks like before, during, and after. Then the second one is creating a disaster supply kit. The third one is now I'm going to capture myself. The third one is evacuation and shelter planning, and the fourth one is managing family and personal stress. So there's specific strategies in there on managing disasters, what that looks like for children, what that looks like for adults, because adults get scared too. I mean,
Mm,
let's face it.
right.
um I'm really frustrated that I can't find this. This is really upsetting with me. Um, hmm.
Is there any way we can get internet with through a disaster? With my son, I think if we lose internet and he can't get his Barney and YouTube stuff on it, that's when he really gets stressed out. Um,
So my suggestion on that would be, now this is not coming up now, and I'm not sure why. My suggestion for that would be to invest in some kind of battery operated device that allows you to play on battery,
mhm.
and then download those
His
videos.
the favorite videos.
Yeah, and
Yes.
have it only for disaster purposes so that you don't end up breaking it or if having a problem with the batteries not working.
Mhm.
Uh, but I would encourage that to have some kind of separate device that is not internet connected, because we all
Good
know
idea.
what that.
Good idea. Mm.
Yeah, now I'm really just very disturbed that I can't find this because I had it up before. You know what? Let me go back and see if I can get it through going all the way back to where I was at the beginning. Have patience with me. I appreciate it. If I go very, very much back, let's see. There it is. Okay. It's under the information hub. That's where it is. Okay. So,
Exciting.
disaster readiness for people with disabilities. There are 2 books here. The first one is Disaster Readiness, and I'm going
Mm,
to open that for you in a minute. And the second is Disaster Supply Kit, how to create one. So
mm,
let's open the readiness booklet. So we used to print these, but it obviously got cost prohibitive. So now
mhm.
you literally have that information on your portal to access. So this is the actual book. It's 12 pages long, and it gives you all the information about evacuation planning, especially with a loved one with a disability, what happens in a flood, what happens obviously in a hurricane, what does an emergency plan look like, how to cope and talk about this with your children.
Good one.
Yes. What are the different definitions of hurricane and tropical storm watches, depressions, warnings, because we know there are all levels to this now.
Mhm.
Uh, Making a plan for individuals with disabilities, the maintenance chart. And then the other one, as I mentioned, was creating a disaster supply kit. And this one, again, talks about what to put in the disaster supply kit. It gives you checklists. It talks about how much of each of the items you should be creating or putting together in there. We have first aid kit, medical needs, sanitation needs, clothing, bedding, tools, supplies, babies. We can't forget babies and animals. They're
Right.
important members of our families. Entertainment, people forget they don't put entertaining activities in those supply kits. And then they realize when the kids are bored, they're, oh my gosh, what do I do now? Car supplies, if you're going to need to leave the area and evacuate, make sure you've got what you need. Special documents, pet supplies, as I mentioned, and of course, notes to take. This is all covered in that 4-part series. And again, I would encourage you to look on our Facebook archive pages and our YouTube pages to check those videos out. I will be doing the 4-part series again over the summer. Usually get a request for that, and it will be on the calendar once again. So if you check out our calendar as the summer progresses, you will be able to capture those 4 parts.
Yeah, and one of the things that I found as far as information and resources go in this direction, if you on Facebook, if you connect with your county emergency preparedness people, a lot of times they'll have information on road closures, bridge closures, or specific things that are going on specific to your area in the state of Florida or where have you. So that's been real helpful for me.
Yeah, and we talk about that as well. And we talk about getting on the special needs registry. If you are evacuating, there's a registry for that so people can find you after a storm. So we talk about all of that in that 4-part series.
Great.
So let's talk about those social stories that Jim mentioned before. So if you
Mm.
have a child, an individual with communication challenges, we have a social story bank. All of these red links are active to open up into a social story that is downloadable and printable. So for example, how to greet adults. Okay, these are obviously made for young children or limited capacity for communication.
Mhm.
And it will explain how to engage with other people. So greeting and talking to adults. And then you can download it and print it and share it with the individual in your family. And honestly, these are really important tools to use for children that might be going into environments that they're unfamiliar with. If there's a lot of sensory input, if there's a lot of sound, if there's a lot of overwhelming, engaging activities like noises, again, arcade might be overwhelming. So again, these are opportunities to kind of engage that child, explain it in advance, and then you can show them in reality when you go out in the community what it is that they're going to do.
Yeah,
You
real
can,
simple. They're real simple drawings or social
yeah,
story.
yeah. Really important.
There's
Parking,
the fire alarm that I remember. The director of Poppin, you've seen that one time for her child because he didn't really understand what happened when you pulled a fire alarm at school.
yeah, that's important. We assume children know about the way to engage in community and environments, and we don't realize that they haven't been taught those skills. So
Right.
these are really great to help.
Hmm.
These are great resources. And along the same lines of the social stories is our sound bank.
Mm.
And Jim, you're familiar with this, right?
Yes. Sometimes sound uh, will send kids into meltdowns or what have you. So this is a way to actually help desensitize that, if that's the right word,
Yep,
for different type of sounds.
absolutely. And this came about again because of a lived experience of one of our staff persons whose child was hypersensitive to noise. And she literally said in one conversation to our director, I wish there was some kind of way to work with that sound so I can get my kid used to it. And we did this. We created this sound bank. They recorded all kinds of different sounds. I'm going to run through it slowly and then I'm going to play one. We have animal sounds, household sounds. We have um, musical instruments. We assume that the kids are used to hearing loud noises, and we aren't. Outside noises, people sounds like cheering in a crowd, or a baby crying, or a person coughing. Um, School sounds. So we take for
Mm.
granted that a child sitting in a classroom is not bothered by sound. I can tell you, I used to teach in an elementary school, and it's interesting when I saw the buzzing of the fluorescent lights here, I thought,
Mhm.
yes, that's definitely an issue for some kids and it bothers them. In fact, I'm going to go ahead and play this and let me know if you're able to hear this. I don't know if I put the sound on, so I may have to go back in and do it. Hold on. Do you hear anything?
Heard something at the start.
Okay, let me try another one.
My son was really sensitive to the fluorescent lights.
Yep.
I don't
Let's
think you
see.
put your sound on.
Do you hear that?
Yes.
Okay. These are sounds that our kids are exposed to regularly, and we don't realize how sensitive they can be. Even myself, I am not sensitive to sound, but when you have a fire drill blaring in your ears and you're
Mhm.
trying to get a classroom out, it's scary. So
Right.
all of these sounds are really important to help desensitize the kids. And what I encourage families to do, and you can share this with the people you work with, let them play this in the safety of their home when the child is rested and well receiving the information. Because if they're engaged, and let them play the recording when they feel like playing it so that they get comfortable with it enough and just keep repeating it over and over again to the point where they get used to hearing it. So when they're out in the community, these noises won't bother them. I mean,
Yeah.
everything can be a problem.
As an adult, we kind of like uh, filter a lot of the different sounds out. When Ben was young, in pre-K or in elementary school, um, he couldn't sit in the cafeteria because of the noises from refrigerators running or the fluorescent lights running. You know, it really educated me on sensitivity to sounds, and I would really love to see the sound bank come about. We've used it several times on different things.
Great. I'm glad to hear that. And I know it's made an impact. When I share this information across the state at presentations, I always get response about the sound bank because
Mhm.
so many people think that it's so unique and that we don't get the opportunity to get that kind of resource regularly. So
Right.
it's really something we're proud of. So I just quickly go to the tip sheets. So here are different downloadable tip sheets. We have exceptional student education acronyms. I don't know how many of you are familiar with all of the acronyms that exist in the IDEA world, but there are a lot.
There's a
And
lot.
so you can print this and share it with families. You can share it with family members of your own household if it's appropriate. I'm going to populate it just so you could see how many acronyms exist.
And if you are a parent and you're sitting in a meeting and they come out with this word soup stuff, the acronyms, it's okay
Yeah.
to say, "Excuse me, but what does that mean?" Um,
Yep. So I'm going to try to get this to go up. Here we go. All right, so it's a trifold. So envision it trifolded, but that's the back of it. And then as you can see, all of these are on the inside. Look at all of those acronyms just for the school environment. So, and that's
right.
not acronyms that are used in the medical world necessarily. So there's a lot there. The other things we have supported decision making. That's something that we may need to think about when we have a child with medical conditions don't allow for them to potentially make their own decisions. We want to make sure we understand what are the options as they transition to adulthood. And we have information on that's the top 10 IEP supports for rural families. We have books here that can be printed, tips for parental involvement, and we have IDEA tips for parents to understand the law, inclusion friendly tips for transition into adulthood. So there's a lot of information there. There's employment and there's healthcare transition information. We also have post-secondary and relationship information that can be downloaded and printed. So you can see we've built quite a large amount of resources here.
It's a huge
And
amount of resources on your website.
yes. Oh, I don't even know the number, to be honest with you. We've lost count. But I am going to flip back to the presentation and go to the very end with our identifying contact information, and then I'll take questions if we have any. So
Yeah.
I'm around a little bit. Sorry about that. Oops.
Oh, you're fine. But we are getting close to that end of the hour there.
So we talked about the two booklets. So I showed you those. They're under the information hub. I just remembered now that I went through it. This is our website. I encourage you to capture that and jump on there for all of those wonderful resources that we just talked about. As I mentioned, we have very active social media platforms. And finally, this is our 800 number. So if you need resources for a family you're working with, if you need resources for your family, or if you have somebody that might need resources for their family, please have them contact us at 800-825-5736. They'll be asked a few questions to find out more about their needs, and then they'll be assigned a staff person who'll reach out to them and make that contact, that warm welcome, and obviously find out how we can support their needs. And with that, I am going to stop sharing and see if there are any questions.
Um, one of the questions that I had that I'm hoping you can work through, we have, according to U.S. Census data, as of 2022, we had an average of 800 plus people moving to Florida a day, like a lot of different people. And a lot of things that I see is medical questions or medical resources. Um, can Star help with things like that?
Absolutely. So the thing that's unique about Family Star and a little different from the parent training information centers is every case is unique. Every case has unique differences and unique challenges and unique needs. So we don't have just a one size fits all for the resources we have. I have an enormous database that I use, that I access information of different resources in different areas. And I share those resources out directly with the families once I've connected with them, or the providers, and they can use it with their families. But those are not on the website because they are constantly changing and they're unique to each community. So we have hundreds and hundreds of resources that we've collated over the years of different community resources. But there are some that are very general that can be used by people, like 211.org.
Mm,
211.org is a national program. It's free of charge. All you do is dial the number 211 in your community. You'll be connected with an organization that has their own database of
mhm,
resources specific to your community. So if you live in Tallahassee, for example, and you call 211, you'll be connected to a Tallahassee-based network that will have the resources specifically for your community. And their resource bank is across every need. So it's not just medical, it's housing, it's financial resources, it's
wow.
paying bills, it's legal advice, really across the spectrum of what our personal needs might be, broader than what we do here at FND.
Mhm,
That's one resource. There's another one called findhelp.org. So that's a
mm,
website, findhelp.org. You go in there, you put your zip code. So it's based by zip codes. And then there are tabs for the different needs. So there's medical needs, there's financial needs, there's housing needs, there's respite care needs, really across the gamut. And you can find it based on your zip code. So you can do your own kind of searching if you want.
mm.
Both of those resources are really valuable because they are very specific to the communities they serve.
Wow, that's wonderful information. Okay, wonderful. Um, it looks like we're just about out of time. I did check the chat box. We don't have anything there.
Right.
Ms. Lees, I want to thank you for your time and your resources. And coming with us today, we'll send out links to everybody who registered, and we'll get that to you also.
Very good. And you
Thank
know
you.
what? I'd be
Hmm.
more than happy to send you, Jim, the FND overview flyer that has all our contact information, and you can send that out with the recording if you'd like.
Okay, we'll do. Thank you so much, everybody, for joining us today, and thank you, Ms. Lisa, once again.
My pleasure.
And we'll be processing this and getting it out later today. Um,
Thank you.
thank you so much.
Have a good day, everyone.
Bye bye.